So I was going to the doctor and I was waiting for such a long time and the doctor wasn't there. So I just thought, forget it. I'm just going to come over to the drugstore here to get my medication.
Okay.
But I was wondering about my sister. I was wondering if you could help me out. She has cancer and it spread to her back and into her kidneys, into her colon, and she's been suffering for 5 years, you know, taking all different kinds of medications, and now she's gone. So I'm wondering if I would get the same disease that she has. It was something with her bones, it started with an O, and I'm wondering if there's a medication that I could take that will prevent it from becoming worse. Do you know of any type of medication like that?
Is it osteoporosis that she had? Do you think that's what it was? Osteoporosis?
Oh yeah, I think that's right. I don't know how to spell it. It's such a long word.
Well, most women are at risk for developing osteoporosis. It really it does not have anything to do with the cancer that she had, although that could have made it worse. But women are at risk for osteoporosis, which is a condition that makes your bones more brittle. And that puts you at risk for breaking hips and small fractures in your vertebrae, which are very painful. And the reason that women are...
And so that would reduce the size then?
Yes, what happens is women that have osteoporosis tend to shrink because their vertebrae, there's fractures and they shrink down in size, and it's a painful situation.
Is there any kind of medication that would help this?
Yeah, yes, there is. As a matter of fact, it's calcium. It's just over the counter. You can buy calcium with vitamin D.
Yeah, I know. It's because people aren't drinking milk. Is that the cause of it? Maybe many people are having problems with their bones?
It's either not drinking enough milk or getting calcium from other sources in your diet. You don't necessarily have to get calcium from milk, but most people don't get enough calcium in their diet. And so, especially women, and as I said, the reason that women are prone to osteoporosis is because your bones are less dense to begin with than males. And so men do get it, but at a much lower rate than women. And so what you should do is if you're not drinking 3 or 4 full glasses of milk every day, which I know I don't, then you should supplement your diet with calcium tablets with vitamin D, because the calcium with vitamin D is more effective than just the calcium alone.
Yeah, I was planning on asking, you know, if people aren't interested in drinking milk, maybe there was some kind of a pill, like the calcium, that they could take.
Yes.
So wouldn't that help the woman with bone issues?
Yes, that will help. Sometimes it's not enough, the calcium alone. If someone has active osteoporosis, and your doctor can actually run a test and do a scan on your foot. You just put your foot in a little, like an X-ray machine. It's called a DEXA scan, and they can tell if you have osteoporosis or something called osteopenia, which is kind of the step before osteoporosis. If you actually do have osteoporosis, then you should be on additional medication. If you don't have osteoporosis, it's still a good idea to take the calcium with vitamin D, because that'll help prevent it down the line. So what I usually recommend to all my patients who are women that are not drinking a lot of dairy or getting a lot of calcium in their diet, even when they're young, is to take calcium with vitamin D every day. Because even if you do not have osteoporosis, you are at risk of it simply because you're a woman. And taking the calcium will help prevent that.
So when I go into the drugstore, can I get, you know, a refill? You know, if they would go ahead and put a label, you know, the doctor said that this is for the different things that I have. Would I get a new prescription?
Oh, for calcium? For the calcium?
Yeah, it would have a new label. you know, and they would write for calcium, and then I would know exactly what the medicine is for. Maybe you could write it in big letters so that I could see exactly what it is inside the bottle. The writing is so small. You know, if I knew exactly that it said calcium.
What we can do, calcium does not require a prescription. I can just sell you a bottle of calcium, but I could actually write on the bottle that it is for strong bones or whatever would help you remember why you were taking it. Now, do you drink milk at all or eat a lot of cheese?
Oh yeah, I do. I drink a lot of milk.
You do?
You know, I've heard a lot about bone trouble, so
how much?
I tend to drink a lot of milk.
3 or 4 glasses of milk a day?
Well, in the morning, and then at noon, and again at night, and before bed. So probably 4 glasses, 4 or 5.
Then you may not need to take extra calcium. You may be just fine.
Well, some days it's less though. But I've heard, you know, that I need to drink a lot more water nowadays too. You know, drink more water than milk. So why would that be?
Well, what?
It's important, you know, to drink water along with the milk, but they say, you know, water will keep your body clean. So
Water's
what do you
important.
think?
I think that you should drink enough water so that you're not thirsty. I don't think you have to go overboard with drinking a lot of water. But I think if you're concerned about osteoporosis, you should, when you see your doctor the next time, ask your doctor, and they could do a screening on you and tell you if you actually do have it or you don't have it. Are you having
Oh,
any?
I didn't even think about that.
Sure. And if you do have it,
You know, I feel okay, except, you know, sometimes my throat, I tend to have a problem, you know, with my throat, but my back and my bones, they seem to be fine. You know, I do have a tendency, it's hard to swallow. I can't eat meat right now, so it's no good. You know, I thought about having surgery, but I just refuse, you know, because I'm so afraid that, you know, they would take my voice away. You know, I can't talk mostly the way it is, so if I was signing with kids, I don't know, I really don't want the surgery, so I'll just have to suffer and put up with it. So, but that, you know, I'll go ahead and ask the doctor about the osteoporosis and ask if I'm okay, or...
Absolutely. Absolutely. It's a quick and easy thing that they can do to determine it, and probably a good idea at your age to check.
Well, I'm 77, you know. See, I'm old.
Not so old. Not so old in these days.
Oh, no, I don't feel old at all. My heart is young, and, you know, I want to get outside and work and do the raking and, you know, keep really active. I don't want to sit inside the house. I'm not lazy, you know. It's quick when you become old, but you need to keep up and just feel young on the inside.
Absolutely, and that's why it's important that you keep your bones nice and strong, right?
Exactly.
Good.
But what about in your legs, with the hips? If I've been having problems with my hips, can you keep the bones strong? But people are always having problems with their hips. Why is that?
Why do the hips? It is the place that people will have fractures, and it's because there's so much weight bearing on those hips, on that hip joint, that it will break. Sometimes people fall and break the hip. Sometimes the hip breaks before they fall. It's hard to determine sometimes, but because there's that weight bearing on that hip joint, it tends to fracture there, or they fall and that's where they fall.
Okay. Thank you so much.
You're welcome.